In this video, I'm going to show you an exercise which is aimed at helping with the mobility of your femoral nerve. So this is a nerve that runs from the spine, it comes out of the spine, but then runs across the front of the pelvis to supply the thigh. It supplies the quadriceps, the muscles in the thigh that straighten the knee, and also supplies a load of the skin around this area. So sometimes if a nerve is a bit sticky in one area, then some gentle movement just of the nerve can help to improve fluid flow inside the nerve sheath and to encourage a bit more movement and also desensitize that nerve so that the next time it gets stretched and moved, it doesn't send a signal saying pain, it sends a different signal, a signal saying stretch and move, which is what we want it to get back to because that's its normal, healthy functioning state. So because the nerve runs across the front of the hip, the way, and it runs down and then turns into another nerve that runs kind of across the front of the knee. So the way to gently kind of extend and lengthen it is by moving the leg backwards. So what we're doing here is we're extending the hip. So to start off with this exercise, we can start both feet on the floor, have something to hold on to, like a kitchen work surface or a banister or something. And we're going to, the affected side, we're going to slide that leg backwards, trying to keep toes facing forward. So the leg is going to slide backwards until you get to the edge of where you feel like you can go to. So not going into a lot of pain. We're going to just where you kind of go, oh, I think that might be starting to get a bit symptomatic there. So just go to the edge of it and then sliding the foot back forwards again. All right. And if you feel like you can get all the way back as far as you can go without that bringing on any symptoms, then that might mean we can bring in a little bit more. So it's actually starting to bend the knee. So this does require your hamstrings to do quite a bit of work. So just being mindful of how it feels in the back of your thigh here. We're going to slide the leg backwards and then just start to bend the knee. And then bring the foot back down again and come forwards again. And you might want to come all the way forwards, see how it feels to just slightly lift the knee up. So we're going to come down, sliding backwards, foot comes all the way back, toes leave the floor, and then coming forwards and coming up. Down, sliding backwards, bend the knee, coming forwards and coming up. So you go to, if coming back like this is enough, then just be sliding the foot back. You don't need to bend the knee and raise the foot. We can bring in some movement of the upper body because the nerve roots that supply the femoral nerve come out of your lumbar spine, where there isn't a huge amount of rotation, but actually a bit of movement in the upper body will slightly give you a little bit of pull at the kind of top end of the nerve. And what we can then do is what's called a slider glider maneuver with a nerve, where one end is pulling and the other is kind of letting go, and then the other end pulls and this end lets go. So we can do this kind of bit like nerve flossing. Well, it gets called nerve flossing. So to do this with the femoral nerve, we can bring some rotation in to the upper body. So we can, if we rotate away from the affected side, that will just do a little bit of gentle pull at the top end of the nerve. So that's our kind of top end pulling. At the bottom end, it's moving the leg back that does gentle pulling of the bottom end of the nerve, or kind of towards the bottom of the nerve. So if we put those both together, we can do pulling at the top, letting go at the bottom with a bit of rotation, and then we can do letting go at the top and pulling at the bottom. So that's going to look like this. We can bring our arm kind of up to the side, be holding on. So if we let go at the top, we'll come back to this kind of neutral position. So we've rotated out, the arm is just out to the side, and then we do a little bit of gentle pulling at the bottom. So the leg comes back. And then, and keep yourself really upright here. And then we can do arm coming in, so we can do a bit of twist through the upper body and bringing the leg in as we do that. Maybe knee coming up off the floor, if that feels okay. Maybe not. So coming out and then in. Out and then in. So this is just this gentle nerve flossing of your femoral nerve, working towards being able to do this kind of twisting and rotation. So with this, with any exercise where we're focusing on the nerve and getting the nerve to just kind of stretch and move a little bit more than it was, when we're going to the edge of it being symptomatic, of it being painful or tingly, we don't want to do too much because it's very easy to overdo it. So I would stick to between 6 to 10 repetitions of this, but little and often. So it's something you could do a few times a day. And you're always being mindful of how it feels. How does it feel afterwards if doing this 10 times has then aggravated the pain so that it's a lot worse, and then that stays at that high level and doesn't settle down again? And that's obviously a bit too much. You can try and have a go with trying carrying on with doing the exercise, but maybe at kind of 50% of what you were doing before. So fewer repetitions, a smaller distance. If you're just moving your leg back like this, that will still be getting gentle pulling at the front of the hip through the femoral nerve. So you could do a much smaller excursion of movement rather than this kind of big one. If you get to the point where you're managing to do kind of swinging your leg all the way back and forwards like this, then that suggests that your femoral nerve probably isn't that sensitive anymore. And if the pain is still ongoing, well, no, if you get to the point where you're doing this and there's no pain, then happy days. Thank you for watching. Hopefully that's been a helpful exercise to learn about.